Hello, everybody. Happy Thursday. Today is Thursday, June 11th. It happens to be my 26th wedding anniversary. And I'll show you. Oh, let's see. There they are. I got roses from my husband. So look how pretty those are. And so today, for our Thursday thoughts, we thought we'd jump ahead till August and start talking about what we might do now to prepare for ragweed allergy season ahead. So our Thursday thoughts for Thursday, June 11th is about seasonal fall allergens. Am I changing or you're changing? Okay. All right. So many of you are aware of the common allergy symptoms: sneezing, congestion, headache, itchy eyes, scratchy throat, sometimes even mouth and throat itching. And that can be especially common to have the roof of your mouth itch when you have oral airway syndrome. And so we're going to teach you a little bit about that today, because I think it's something not a lot of people know about in connection with ragweed allergy. So which seasonal allergen do you have? Many people in Georgia do have seasonal allergens, and they vary with the changing seasons. In spring, we tend to get trees, and as spring merges into summer, we get grasses. As summer goes into fall, that's when we see ragweed. Fall is mostly dust mites, and winter is the pines and the mountain cedar, which, by the way, can make many people also allergic to their fresh Christmas trees. So we see some winter allergens come through that. Year round, we have mold, environmental mold, and of course animals, pet dander, and also things like cockroach when we talk about dust mites can sometimes be all year round, not just seasonal in the fall. So kind of depends on the temperature and humidity of your home environment. Interestingly, dust mites seem to do better on a slab than they do in a basement. There's something unique about the temperature and humidity in a cement slab that really encourages dust mite reproduction. So tidbit in case you didn't know. So we're going to talk now about ragweed, because even though it has a very short-lived season and ragweed can only survive the plant itself for one season, it's an annual, a single plant can produce 1 billion pollen grains of misery during its lifetime. And of the people who suffer from seasonal allergies, about 75% of them are actually allergic to ragweed. So who knew this common roadside plant could cause such misery? But it's interesting that many people think, and so ragweed allergy symptoms include the common stuff: itchy, watery eyes, stuffy, runny nose, sneezing, wheezing and coughing, headache, scratchy throat. And there's a picture of your lovely ragweed plant. It's so innocent looking, but it causes such misery for so many people. Many people mistake it for other plants. They think that they think it's ragweed. They see these yellow flowers on the side of the road and they go, that's ragweed. That's what I'm allergic to. And it's not. That's goldenrod. Goldenrod is not the same as ragweed. They do happen to be blooming both at the same time. So many people will have itchy, watery eyes when this plant is out, but that's not the culprit. And it's not mugwort, which looks very much like ragweed there on the left, or a little bit like sort of cilantro ragweed combination. Mugwort does not usually cause allergens. Ragweed sure does. And it can be double trouble if you have another allergen. Dust mites and ragweed is a problem. Mold and ragweed is a problem. We call that the 1-2 allergic punch. So ragweed season can trigger something called the oral allergy season. So when the air is filled with ragweed pollen, a food that might normally not cause an allergic reaction suddenly can cause problems for people who have ragweed allergy. So symptoms of oral allergy syndrome include itchy mouth, itchy eyes, nose, itchy on the roof of your mouth, congestion, runny nose, and sometimes even gastrointestinal disturbances. I have a girlfriend who always told me that whenever she had the pollen season was about, she could always tell because she got tummy trouble. I was like, you're making that up. That can't possibly be true. And then I learned about oral allergy syndrome and realized that she was probably right, and that because of the histamine that's released, it causes an influx of fluid into the GI tract, which can increase bowel frequency and make that sick, yucky tummy feeling. So I want to talk about foods briefly, because during the allergy season, for someone who has oral allergy syndrome, when the ragweed particles are all around and they add to that cantaloupe, muskmelon, honeydew, then they can have some real trouble with worsening oral symptoms. Banana is one of these, zucchini is another, mango, even milk, mince, and lettuce. So those of you that want to enjoy a mint julep with some avocado mango salsa in ragweed season, you might be in for some real trouble. What I also think is interesting is that there is mango and banana are also on the list of latex allergy cross-reactors. So I have never seen that ragweed cross-reacts with latex, but it wouldn't surprise me if one day we came out with a study that found that that was also true. Since we're using so much less latex in the medical environment today, we may not be likely to see it, but I suspect it could be an issue. So during the ragweed pollen season, you might want to avoid that. So very commonly during the ragweed season, people come to the office, not so much complaining of allergy symptoms, because most people get those under pretty good control, but they come to this office complaining of sinus infection. So what's the connection between allergic symptoms and infection symptoms? Well, if you look at that picture, these are pathology specimens. So they took a biopsy of somebody's nasal mucosa, the skin lining of the inside of the nose, twice. And on the left, you see the control. So there's Heather with your cursor. Can you see my cursor if I draw, or only you can see yours? Yeah, okay. So if you look at that top, that dark purple line across the top, it looks like almost a slide where it's really smooth all the way across the top. And there's some cells, those little purple dots are epithelial cells, and down in the bottom in the lamina propria, there's a bunch of inflammation cells down there. Well, when you get an allergic trigger, that whole bottom part that's light purple becomes dark purple. And all those are inflammation cells. And all of those cells can exude fluid, which is part of why you get that sticky, runny nose. Also, look at that thin line, that slide no longer exists. Now it's a bumpy, jaggedy, irregular margin along the top. And that bumpy margin means that there's a great opportunity place for bacteria and viruses to stick, including coronavirus, should it be around in the environment. So you want to try to keep your mucous membranes as smooth and normal as possible and not suffer with that allergic stuff, because that allergy is what predisposes you to the likelihood of getting a secondary infection that might require a trip to the office and even treatment. So keep those sinuses under control. How do you do that? Well, most people think their natural reaction is to go for an antihistamine. We like over-the-counter antihistamines, and especially antihistamine decongestant combinations. There's nasal sprays and eye drops that can temporarily relieve the allergy symptoms. But remember, these are really just symptom silencers. They've done nothing to treat the underlying condition, with one exception, and that is the steroid nasal spray, such as Flonase or Nasonex. They can actually have a bit of a preventive treatment towards reducing the amount of jaggedy, irregular mucus lining. But the others all just take away the symptoms. And we definitely know that the symptom is taking them early on. When it comes to sprays like Flonase or Nasonex, the medicine you spray today makes your sinuses less allergic, less puffy, less drippy, less stuffy tomorrow. The medicine you use this week makes your sinuses even better next week. And if you've used it for a whole month, next month will be much better than this month. So it's cumulative. So you really shouldn't wait, if you're prone to this, until the symptoms are all jacked up. Start early on. The earlier the better. In fact, sometimes we even start a week or two before the predicted symptoms when it comes to these silencer treatments. And even though they may make you feel better briefly, they really don't alter the course of the disease. So every year, your symptoms are going to come back the same. But guess what? We have a long-term solution option here at Campbell Family Medicine, because for ragweed sufferers who want a longer-term solution, we can make allergy drops. These help to retrain your immune system to be able to tolerate the ragweed. Eventually, over time, that will completely eliminate or drastically reduce the symptoms and the need for long-term medications. The oral airway is connected to the nasopharyngeal airway, is connected to the bronchial airway, is connected to the lung airway. So it's one whole airway, and by controlling nasal symptoms, we can often control lung symptoms. So for those people who are allergy asthma sufferers, we often find these allergy drops can improve asthma as well. How do we do these things? Well, the allergy drops that are taken under the tongue at a gradually increasing dose, so that we can make you less miserable in a self-administered bottle. These allergy drops help the body to begin tolerance before the season even begins. And speaking of allergens, we have this terrible air quality in our office this week, so it's making me crazy. So I like to use the bucket analogy, and I like to say when it comes to overflowing bucket, did those last drops of water go in cause the bucket to overflow, or really was it the combined influence of all of the drops together that did the trick and made the bucket overflow? The same is true for allergic symptoms. Sometimes you might be a little bit allergic to dust mites, a little bit allergic to ragweed, a little bit allergic to some of these oral foods, a little bit allergic to mold. And then something blooms and now you are absolutely miserable. So sometimes you can tolerate a little bit of something, but not a lot of everything at once. So by identifying your triggers, you have more control over your symptoms. So how do you know what your triggers are? Well, I asked that question one slide too soon, because first we're going to talk about how to empty the bucket. Some of the ways you can empty the bucket are simple environmental control. So first thing, during ragweed pollen season, if you are ragweed allergic, keep your windows closed. Don't let the fresh air in, and run your air conditioner because it has filters. The newer, better air conditioners have high efficiency particulate filters, the HEPA filters, and they pull out all this microscopic pollen. Take a shower at night because you've been out and about, you've gone in and out, you've been in and around the community, and there's pollen on your body. So by showering at night before you go to bed, you can reduce the pollen exposure that your little sinuses are going to suffer through the night. During the hours of 10 a.m. to 3 p.m., that's when the air has the highest pollen count. So after the dew has dried off in the morning hours until the hot sun shuts everything down in the evening. So avoid the hours of 10 to 3 because that's the most allergic time. Unless you want to get vitamin D, those are the best hours to get vitamin D. Use allergy drops in your medicine consistently. Skipping doses worsens your outcomes. Rinse your sinuses. I'm a huge fan of nasal lavage. I like to use neti pot. I like to use the Navage device. I like to use just buckets and buckets of water saline squirted up your nose. Doesn't really matter, but we want to get as much of that pollen off those mucous membranes as we can. Use a dehumidifier. This is especially important if you're one of the one of the dust mite sufferers, because dust mites have a very narrow range of humidity that they like to grow in. So keeping the air a little bit drier can reduce the reproducing rate of the dust mites. And then avoid those allergy triggers. So how do you know which allergies are your triggers? Well, wait, one more too soon again. Oh, rats. I forgot the order I put my slides in. So what about sublingual immunotherapy? So what is that? Well, we don't want summer and early fall allergies to control your ability to enjoy the outdoors. We think outdoors is so medicinal and so helpful. We want you to enjoy it. You can come see us and talk about whether custom allergy drops are right for you. Allergy drops helps build your tolerance to allergens over time, and you can come see us at the office to see if you're a candidate. What would we do if you came to see us? Well, first thing we would do is make a consult and say, yeah, it sounds to me like you have classic allergy symptoms. Let's draw your blood. If you go to the allergist office, they will commonly do a pinprick test on your back to look for allergens. We don't do that. There are a few cases where that might be recommended, but for the most part, we can get the information that we need from a simple blood test. We send your labs to usually Quest lab, but sometimes other labs. And it'll give us a written report of the allergens that you are responding to and how much of an immune reaction you're having. Once we get that report, we can send it off to the compounding pharmacy that makes the serum solutions. And these are sublingual allergy drops. At the allergist office, the only option they would give you most of the time are allergy shots. Come see us once a week for 6 months, every other week for 6 more months, and then twice a week or once a month for the next 3 years. Sublingual immunotherapy is often also a 1 to 2 year commitment, but no allergy shots are needed. No trip to the doctors is needed to tweak anything. We can do everything by paper and telephone. Once we've gotten your blood drawn, we can create your allergy drops. You carry the little dropper bottle around. You do drops underneath your tongue, usually twice a day for 1 to 2 years. But you bring them with you on your vacation. You don't need to schedule your holiday around your shots. You don't need to worry about if you're sick or there's COVID and you can't get to the office. You always have your allergy drops with you. And then over time, we increase the strength so that your immune system becomes more and more tolerant of this particular allergen. So if you happen to have other allergies, I have a handful of patients who are already doing sublingual allergy drops. And they're like, but I'm already on treatment and I'm thinking I'm going to get worse. Now what do I do? Well, we have an option for them called accelerated sublingual immunotherapy, which is higher dose of the ragweed antigens on top of the regular stuff that you're already taking. So we use a rapid escalation starting about 8 weeks before the peak allergy season. And then we continue throughout their regular season, their regular stuff that they always take. But so it's essentially a booster to their year-round allergy drop therapy, and it can give significant additional seasonal symptom relief for those who are ragweed sensitive. So June 15th is when we generally start talking about starting your pre-seasonal allergy drop treatment if you're a ragweed sufferer. August 15th is typically about the time when the symptoms begin, and they continue typically until the second hard frost of the season. The first hard frost doesn't always kill all the plants, but the second frost usually does. So if you haven't been tested before for ragweed, then we would need to do blood. But if you're already on other allergy drops, just call us up and say, I do get ragweed. I would like to add to that, and we can just order your drops and get them sent away. So what if you're like, oh no, I'm under house arrest. I can't leave my house. I can't come get blood drawn. I'm afraid to leave the comfort and safety of my home. I'm just gonna suffer through. Don't you have something you can help me suffer through? Heather, why don't you talk about these, because these are certainly in your wheelhouse.
I have lots of personal experience with allergies. And honestly, Dr. Campbell, I thought of a good question that probably a lot of your patients are going to ask you about when it comes to these allergy drops is, I've already had allergy shots, but can I get these anyway?
Yes, the answer is yes.
So I personally have found Thorne Research, their quercetinase product, to be extremely helpful. It contains quercetin and bromelain, so it helps to diminish that allergy response and all those symptoms that you get, especially if you use it like a pre-treatment, like Dr. Campbell was talking about. So often I know I'm going to have allergy symptoms in March, so I start my quercetinase in January, and that helps. This year I forgot. I had a lot of bad allergy symptoms. So it was just a kind of an interesting experiment that I didn't mean to conduct that really reinforced how helpful that has been. Dehyst and Air Max also contain quercetin and other anti-inflammatory ingredients. And so you may find that one works better for you than another. I personally don't do Dehyst because it contains apple, and I have a food sensitivity to apple. Air Max, I love. And it just depends on where they get the ingredients from, because the bromelain can come from apple or from pineapple, and so that makes a difference. As Dr. Campbell mentioned, using a neti pot is extremely helpful at clearing your sinuses and cleaning out all the junk that can collect. We have instructions here in the office. We have a handout if you are interested and need help with that. But please remember to use a clean water source. We don't want you to use it straight from the tap. Like distilled water or saline, things like that, that are cleaner and tolerated better. And then over-the-counter Claritin, Zyrtec, Flonase, Nasonex, as she discussed, these are helpful Band-Aid type options because sometimes, like if we react a little too late or if our allergies are particularly bad, we might need a little extra help. Keep in mind that if you do take an antihistamine long-term, you may sometimes experience a little bit of withdrawal effect. They can actually cause some itching when you come off of them. And also that when you do take them, if you haven't before, they can make you a little sleepy or groggy. So make sure you know how you're going to react before you get in a car and drive.
And we also want to mention that there has been some suggestion that the long-term use of antihistamines can be associated with the increased risk of Alzheimer's disease later in life. So we don't want to take these medicines all the time. Now, if you get stung by a bee, I really want you to take some Claritin or Zyrtec because it's going to reduce the amount of inflammatory reaction that you have, reduce the itch and the discomfort, but that's not an everyday thing. By the way, if it happens to happen to you out in the woods and you can find a plantain plant, this is one of my favorite herbal tricks. Plantain looks a little bit like a hosta weed. It's a flat, oval-shaped leaf, slightly pointed on the end. It's got thick ribs in the middle of it. If you can find one of those plantain leaves, not plantain the banana, but plantain the weed that looks like a hosta, take that up, crush it, put it in your mouth, chew it, make a little poultice, and slap it on your sting. It will instantly take away the pain and swelling. It's my favorite herbal remedy. So, but also Zyrtec and Claritin also work. And so sometimes too do digestive enzymes. If you're out and about and you get stung, you can take a digestive enzyme, chew it up, make a paste, put it on the sting. That'll partially digest the sting venom. So that's your Susie Homemaker tidbits for the day. Didn't even have them on the slide.
That's an awesome tip.
All right, is that the end of our slides or we have one more?
Just questions.
Just questions. Does anybody have any questions we didn't already ask? You can unmute yourself if you do. Or I can unmute everybody. Let's see. Oh, guess what? I don't think I hit the record. Yeah, maybe I did hit the recording button.
You did.
I did.
There's your red dot.
Participants. Everybody is, yeah, well, I can't figure out how to unmute everybody. So if anybody has questions, you can ask us. Otherwise, we're going to call it a wrap. Oh, there's a chat question. Oh, I found a chat question. It says, thank you. We'll see you in the morning. Great. You're welcome. We'll see you in the morning. Thanks, Marilyn. Bye, everybody. We'll have this recorded so you can share it with all your friends and family members, including my secret tips that weren't on the slides. You had to listen to the audio to learn them. So thanks, everybody. We'll talk to you later.